What's up, everyone? Welcome back to another episode of the Milwaukee Sports Performance Podcast. This is going to be another live edition going through some specific movement patterns. I'm joined again by Dr. Hannah Grieving, and she is going to walk us through some of the most common injury-prone positions that we see people get hurt in lacrosse, really mostly talking about knees, ankles, kind of lower body things. So Hannah, thanks for taking more time and walking us through lacrosse moves again.
Yep, love it. Happy to be here.
All right, so let's start off, like lacrosse-wise, what are some of the most common injuries that we typically see in the clinic with lacrosse players?
Yep, definitely common knee pain, patellar tendon, patellar tendonitis, tendinopathy, patellofemoral pain, sometimes ACL tears, unfortunately. Also ankle sprains and any like lower extremity kind of groin, quad, or hamstring strain, also pretty common.
Yeah, for sure. So let's just talk about maybe big picture before we get into some specifics. What are maybe overall some things that you look for general movement of lacrosse players that, you think are maybe a little bit more, not better coordinated is the right word, but just a little bit safer and maybe perform better? Like, what are some big picture archetypes that you like to see on the field?
Yeah, definitely we want to make sure that we're in that athletic stance, right? At first, super tall or super stiff, right? We're then putting a lot of that stress through the joints, through the ligaments. And so making sure that if I'm doing a dodge, if I'm doing any defensive positioning, I want to make sure that I have that slight bend in my knees and I'm in that athletic stance, whether I'm going here or whether I'm trying to guard an opponent. I want to make sure I'm always in just that little bit of like a knee bend, hips are engaged, and I'm ready to go from there. I think sometimes people get caught like being too high or like leaning too much with their upper body when playing defense. And so that can just offset like what we're doing with our upper and lower body, and they can put just more torque through knees especially, but also hips and ankles too. So definitely making sure that we're having that load where we want it to be and not being too offset or too stiff or too low.
I think there's a lot of good stuff in there with some of the positioning things we'll get through and just overall control. I mean, got to be able to sequence. And I think stability is a word that gets thrown around a lot in our profession, and it's always hard to define. And I heard someone talk about it like in a way that made a lot of sense to me, where it's like, yeah, like what does core stability mean? It's like, well, it probably means the ability to like fixate one segment and move another and like coordinate that where you don't get too far outside of your base of support in any one direction. So, well, no, that's really interesting. Let's maybe dive into some specifics. Are there maybe two or three things that we want to talk about today and kind of break down in detail on some more efficient ways to move if you're on the field?
Yep, definitely. We can start with a roll dodge. This one is a common dodge that we use, but can also be pretty aggressive on kind of the hip, knee, and ankle joints. And so one thing that we always want to make sure that we're looking for is, again, the position of the knee as we step towards the defender. So again, I'm starting with my foot fire here. Once I make this plant, if I am to then roll behind myself, right, you see that this is a pretty like injurious position of that knee can sometimes come forward into where we don't want it to be. So as I'm approaching here, I need to make sure that I have a good plant here, but I'm also then rotating my hips and protecting my stick behind me. So you can see that my leg as I step towards with my left, and then continuing to pivot on that leg and swing this hip around to then go around Dr. Falk that way. So I want to make sure that I'm really being strong through that plant, but also being mobile through it. So I'm not just planting and twisting.
Yeah, I think that there's a few things that I noticed as I was kind of up close here with you that instantly became obvious to me. When Hannah was kind of referencing not seeing that knee go in, knees are supposed to be like a hinge joint where they open and close, bend and straighten really. They don't like twisting often. And so when we get in a position that there is twisting involved, we want to see that range of motion come somewhere else, either the foot on the ground moving, the hips rotating, but something other than that knee that tweaks and torques. So that's often where we'll see meniscus and ligament injuries with that twisting pattern. And I felt the second thing that was really interesting as I was up close is really watching like how deep that knee angle gets where it's really, really bent, and like how coordinated Hannah was. It's not like her shoulders were opening and then her hips were going. It was like, she's like really moving her body in one unit and keeping that stick in front of her. And it, just is a very efficient way to both kind of perform well with the movement and then also hopefully keep the lower body a little safer.
One of the things that I always tell my girls is that we should almost match what lower body and feet are doing to what upper body and hands are doing. So as I'm coming towards, right, I'm opening up with my hip as I step back, and I'm opening up with my shoulders as I turn this way, and everything still stays on that same path of upper and lower body. So that's always a good good thing for us to do is always have that sequence and control as we especially do a roll dodge or even a rocker where we then can go the other way.
Yeah, very, very interesting. Okay, so that's the roll dodge. What's something else that you see a lot of injuries happen at in lacrosse that you want to dive into?
Yep. Another one is any like high balls or especially on the draw. It's a lot of times, right? The ball is coming up high and we're having to then like single arm grabs. We have a lot of extension through the upper body. We're trying to be propulsive as we leave the ground and get those high balls. And so that can be a common, place of injury just because there's a lot out of our control. We have an opponent right next to us. The ball is going somewhere where we're not completely sure. And we're still having a lot of our body or arms away from us, trying to then be explosive with our lower body. Again, maybe someone comes underneath us. It's just a lot of uncertainty that can also lead to the injury risk if we're not able to absorb that force and land properly and don't know if there's other people around us either.
Yeah, no, that's perfect. So, what are some things that they can still accomplish that task, be able to perform well, but try to keep their bodies a little bit safer, whether it be on the landing or the actual taking off part during that
Yep.
in that movement?
What I really like to practice is just pretending like you're almost in that draw type position, even if you're on the circle, if you're on the restraining line behind, right? There are times when the ball can come over. So what I like to do is just like a self toss into a grab. Obviously, the ceilings aren't too high, but again, I'm coming, throwing the ball to myself, really trying to work on tracking that ball, but then landing almost like a single leg hop. And again, you can throw it higher to make it more aggressive. You can keep it low. You can, again, have someone toss you the ball. You don't know where it's going. But a lot of the things that we do for my girls that I coach, we always have those high balls included with practices with shuttles just to make sure we're really working on that as it can then commonly show up in the games as well.
Yeah, I think that's really interesting. Something that kind of caught my eye that I think is part of all our ACL and really major lower body injuries and rehab here is we try to do like we talk about cognitive and visual distractions, right? Oftentimes in rehab, if you're just sitting here doing jumps and lands and able to focus on the ground and your knee and what's going on, that's great. It's really important to be able to do that. But now you go out and you're not thinking about what happened in your knee. You're looking up at the ball. You're thinking about like, what are you going to do with the ball? If you get it, what next? You're not thinking about it. And so incorporating some of those distractive type things into your skills and movements as you're practicing, I think is probably a really good routine to keep in day out so that when you get back on the game, you're actually able to perform and win the draw and not just worry about, you're probably not winning very many balls if you're worried about what knee position you're in
Exactly.
when you land.
It's nice to have part of your therapy be, taking, whether it's the strobe glasses, whether it's adding in your stick, adding in, basketball, soccer ball, like anything where you can then in those later stages add in that return to sport type stuff. That's what you're going to be seeing on the field, which is super important once we reach kind of that return to play.
Yeah, for sure. Okay, we've talked about like offensive players. They get to have the ball. They get all the goals and
Yeah.
glory. But what about our defenders? They have a tough job to try to keep the offensive players in front of them. Are there any, common injury type positions that the defenders get into regularly that we could kind of help out move more efficiently?
Yep, definitely. In terms of defense, right? We always want to be again in that like athletic, like low position. As you are trying to move around me, I'm then trying to keep almost like perpendicular to you, right? The second that I open up my hips here, if I get beat and then I open up my hips and I try to lean one way or the other, right, you're going to beat me. Pretty commonly seen again in soccer and basketball, other sports, but we want to be able to keep this strong base and move quickly laterally instead of then trying to, if you get past me and I'm not ready, right, and then like leaning and with my upper body and then my again, lower body's in that injurious position if we're not ready for it. So especially if we get beat on these 1v1 in those 1v1 situations, it's then hard for us to then recover from those. And we're trying to just do everything we can to try to keep our body in front of yours. But that can also be another injurious position is when we're losing our lateral quick movements and then maybe trying everything we can to get back in front of
for
you.
sure. So let's break down that defensive based position. What do you want to see here relative to shoulder positions, knee positions? How would you, if you were to teach me how to play defense in lacrosse, how would you want my body to be set up?
Ideally, we're again staying perpendicular in a way. Sometimes it may depend which way we're forcing the defender, whether it's out to the side, whether it's towards our hedge or our help, that will change. But once this contact is already established, what I want to do is making sure that I'm in this low athletic position, right? Slight bend in the knees, slight bend in the hips, when I'm staying with a slight kind of hinge. And then again, I want my stick to be able to move side to side. So I have a nice strong base. I want to be able to move my stick so I can mirror the opponent, whether they're going to take a shot or take a pass. I want to be able to try to reach from there. But again, we don't want to be super upright and super stiff here just because that's going to have us lean a little bit more. We want to really sink into those hips, use our feet. Sometimes I'll even have my girls try 1v1s without their stick just so they don't have to rely on their hands. Again, defense is really starts at the base and works its way up. If we don't have our feet in front of, our opponent, that's when we get into that leaning position. So ideally we have a nice strong base here. I'm able to be flexible and move with that strong core as you pass, as you shoot. I want to still be able to be mobile and active with my upper body while my lower body kind of does 99% of the work.
Yeah. I think what's really cool about some of these techniques that you walk through, and this isn't always the case because sometimes performance and health don't go hand in hand. Like when we push the physiology, what the body can do, sometimes it breaks. But I think everything you walk through today, it's like not only does it put your body in a better position to stay healthy, but it also seems like it's putting you in a better position to actually do your job and perform on the field, which is ultimately what everyone, other than the kids that get hurt, everyone really wants to perform better. So by taking care of some of these little things, you can really solve both issues and move more efficiently while you're out there enjoying your sport and hopefully staying out there for the long run. Well, thank you for walking us through some more lacrosse details there. Thanks to everyone for listening, and we'll see you guys on the next episode.